Another remedy, my friends, where you can prescribe on look and diagnose. Again, one of my some clinic cases, believe me, I did not ask a single question in this case because I saw the skin, I felt the skin. That was very important. Whenever you look at the top skin, that was the first visit, you can see the first follow-up, and it was completely cleared up. Why and how? When you touch the skin with the back of your hand, you feel it's dry, but it's not the regular dryness. N.M. Chaudhary in his Materia Medica, I'm sure you've heard about N.M. Chaudhary, one of pioneer Bengal homeopaths, mentions that whenever you feel the skin, it's called what you call as parchment dry skin. What do you mean by parchment dry? If you think of sandpaper, which you use to polish the wood, it has a rough and dry quality to it. And that is the exact feeling when you touch the skin. It feels rough, at the same time it feels dry. And that's the parchment dryness of the skin. I'll dissect the skin miasmatically for you. So parchment dryness, sora. Dry, lack of secretion, hypo, moisture is not there, sora. If you see, there are patches of blackening of the skin. As you can see here, in these areas, there is blackening of the skin. Excess, psychotic. There are some areas where you'll find there is cracks as well. It's not very prominent here, but I've circled that part where you can find cracks as well. Miasm, syphilitic. So looking at these two hands, you can understand all the three miasms were present in equal degree. So you have the dryness, but it's not the regular dryness. Do remember the word parchment dryness. You won't find that in your repertory, but again, Materia Medica will give you a clear picture where you understand it's parchment dry and rough. There's blackening of the skin as well. And there are portions where you have cracks in the skin as well. My friends, go back to those cases where you're having failures of eczema, failures with psoriasis. Look at the skin. Feel the skin. If you see it's a very dry skin, feel it with the back of your hand. If you feel it's like the sandpaper, which is dry and rough, my friends, you should always prescribe graphitis in those cases. Because, my friends, in graphitis, you have all the three miasms in the skin. You have the dryness, parchment dryness of sora. You have the blackening of skin, which is psychotic. Why blackening? Graphitis prepared from black lead. Doctrine of signature, blackening. Cracks, syphilitic. What oozes from the cracks? What comes out from the cracks? It's a thick, sticky, honey-like discharge, watery discharge. So you have all three miasms present in the skin. What else can you find with graphitis? Do remember, my friends, it is Tyler's trio of cicatricial diathesis. So Tyler mentions in her Materia Medica, Margaret Tyler mentions in her drug pictures, the causticum, graphitis, silica is her trio of cicatricial diathesis. So whenever you come across cases of acne scars, whenever you come across cases of cesarean section scars, hysterectomy scars, appendicectomy scars, keloids, where you have blackening of the skin, where the surrounding skin is parchment dry, feel the skin, otherwise you'll miss a graphitis prescription. So very many of those cases, my friends, I'm sure I've shared with you, look at the skin, but for graphitis, you must feel the skin to understand how it feels like a sandpaper, how it feels like the parchment dryness. And no other medicine, the entire Materia Medica will have these features as your graphitis. 30C was prescribed single dose. You can see she came back in 4 weeks' time, gone. And that's the beauty of classical prescribing. So, my friends, whenever you come across cases of blackening of the skin, when you have this kind of parchment dryness with the cracks, with the blackening, think of graphitis. When you have the blackening with pus formation, with suppuration, it's gunpowder. Whenever you have the blackening with circulatory imbalance, with the coldness and debility of carbonates, it's carboanimalus. So my friends, all of these remedies can help you in cases where you are having failures with skin cases.